Hello, everybody. My name is Stacey Adelman, and I'm a registered psychologist and owner at Joshua Tree Learning Center. And every Tuesday at 12, we go live on Facebook, and we talk about a variety of different topics and try to answer some of the questions that come in to us. And so today I want to introduce you to Cassie Brown. Cassie is one of our counselors here at Joshua Tree Learning Center. She has a master's degree in social work. And so what she is going to be talking with us about today is PMDD, premenstrual dysphoric disorder. So I think this is something that we just don't talk about enough. It involves stigma from two different angles. We're talking about mental health, and we're also talking about menstruation. And so, both are kind of taboo topics we don't talk about very often. So today we wanted to start opening up that conversation a little bit. And this is a topic very near and dear to Cassie's heart. So I'd like to introduce you to Cassie Brown. Cassie, maybe to start us off, can you tell us a little bit about PMDD? I understand it's Awareness Month in April. So if you could start us off by talking a little bit about that.
Yeah, Stacey. So it is Awareness Month every April because of the stigmas you mentioned. It is a really unknown condition, and even a lot of doctors and psychologists, social workers, any type of counselor have never heard of it before, which leads a lot of women, such as myself, to going misdiagnosed or undiagnosed for an average of 12 years before finally getting an accurate diagnosis and access to support and treatment that they need. And so every April, we try to do as many awareness events as possible to raise education on these disorders and connect people with some helpful resources if they see themselves in the symptoms. And so
Okay.
1 in 20 women or people assigned female at birth worldwide have premenstrual dysphoric disorder or premenstrual exacerbation. However, the actual prevalence is estimated to be a lot higher, but because of the lack of awareness in medical professionals and the low rates of accurate diagnoses, a lot of women are struggling in silence. And
Okay.
so PMDD is a chronic illness that currently has no cure. It is an abnormal, severe reaction in the brain to the rise and fall of estrogen and progesterone. Therefore, it's directly connected to the menstrual cycle. In
Okay.
2017, the National Institute of Health actually discovered that women or people assigned female at birth with PMDD have differences in the gene that processes sex hormones. Therefore, it's actually suspected to be a cellular disorder in the brain. And so, what does this actually look like? In
Yeah.
the first 2 weeks of the menstrual cycle or the follicular phase, women will notice that they feel like themselves and they're not experiencing any symptoms with premenstrual dysphoric disorder. However, around ovulation, they may start to see a rise of some symptoms just in that ovulation phase. And then in that luteal phase, that 2 weeks before menstruation actually begins, they will notice severe debilitating symptoms that occur. And then at about day 3 of menstruation, the symptoms start to subside and they start to feel like themselves again. And so a lot of people with this condition will liken it to feeling like they are possessed every month because they are themselves. They can do everything that they used to be able to do. There's no symptoms. And then it feels like almost being an entirely different person with different capabilities. And symptoms can worsen over time and around reproductive events, such as the first menstrual cycle, pregnancy, births or miscarriages, and when women start to enter perimenopause.
Okay.
And so women hold these symptoms their whole lives until they've gone through menopause, and then the symptoms naturally relieve because they don't have the same changes with the reproductive hormones.
Okay. This is different, Cassie, than PMS, right?
Very much so. So think of it as PMS symptoms on steroids. So
Okay.
PMDD symptoms will vary for every person, but they can include severe emotional and mood changes and mood swings. You'll see symptoms of anxiety and depression.
Hmm.
There will be this sensitivity to perceived criticism or rejection that is heightened. There will be a massive increase in irritability and anger. There will be
Okay.
difficulties with concentration and memory, and there will be a high degree of fatigue, and with that, low energy, low motivation. There is
Okay.
often a lot of sleep disturbances or insomnia. There
Okay.
tends to be a high amount of body dysmorphia. So when you look at yourself only seeing perceived flaws and just really hating how you look. And again, all of these symptoms are in that luteal phase. There can
Okay.
also be an increased risk of suicidal thoughts and suicidal behaviors for women who experience these symptoms. And then on top of all of the psychological side effects, there's also a lot of physical symptoms that manifest, much like PMS, but to a severe debilitating degree. So women will notice joint pain, abdominal bloating, digestive issues, back pain, and a high frequency of headaches and migraines. And so how this differs from normal PMS is
Hmm.
that the symptoms are so debilitating that it begins to cause severe emotional and personal harm. And so
Okay.
there can be consequences in interpersonal relationships. There can be difficulties maintaining work because the symptoms are so disruptive that you can barely get out of bed in the morning, let alone hold down a job.
Okay.
And there can be this kind of process of grief that happens because you grieve for your former self who was able to be consistent in your functioning and able to meet the expectations that you and others have had for yourself. And so there's this real process of grief around learning how to deal with the symptoms and this new state of being.
Okay. And are we seeing this happening with teenage girls as well as women in their later years? So would you say all
Yeah,
ages affected?
all ages can be affected. So it starts to show up around any reproductive event. So a lot of girls will start to see it after their first period. They'll start to notice that they have to skip school because of their period, or they can't do regular activities because the symptoms are that debilitating that they can't participate.
Yeah.
They might see higher levels of interpersonal conflict in that luteal phase because it's more difficult to socialize when you have no energy and you're irritable and you're really sensitive to criticism. And then some women won't notice it until after birth. And particularly women who have struggled with postpartum symptoms of any kind are particularly at risk for developing PMDD or PME after that event.
So how does somebody get diagnosed? What's the
Yeah,
process?
so unfortunately, there's no test yet that can be run. And so the process currently looks like monitoring your cycle and your symptoms for 2 menstrual cycles, and
Mhm.
then screening yourself for if you have any of the symptoms that we discussed earlier. And to be diagnosed according to the DSM-5, which is a diagnostic manual, you need to have at least 5 of the symptoms.
Okay. Who do you
And
go to for a diagnosis?
so you can go to your general physician. However, a lot of women experience a lot of what's called medical gaslighting, where we're
Mhm.
told our whole lives that that's just how a period is, that's
Mhm.
normal, there's nothing wrong, but you know that something is wrong. A lot of women will be ignored by their doctor, or they'll be diagnosed with anxiety or depression or bipolar because of the cyclical nature of the
Ah,
illness.
interesting.
And
Okay.
so, really important if you identify with any of these symptoms that you are advocating for yourself in the diagnostic process. You might unfortunately have to educate your doctor and bring
Mhm.
them information on this is what PMDD is, this is how I assess it, and here is my tracking for the last 2 months that demonstrates that I have it. If you're
Okay.
finding your doctor is not being respectful of what you're saying and they're not listening to you and honoring your knowledge of your body, it is okay to get another opinion and it's okay to go see a different doctor.
Do you notice, is there a difference in the periods themselves, or is it only the mood that you're noticing a primary change? So we talked about the physical changes, and we talked about the mood. I'm just wondering with the period itself, is it tend to
Some
be
women
heavier, or does it
might
not
notice
matter?
that it could be a heavier flow. Some
Mhm.
women might notice that they also might have more of the cramping and the pain
Mhm.
than their peers. However, that's really fluctual. It tends to be very distinct for each woman what she experiences. And just
Okay.
want to touch on PMDD's cousin, which is premenstrual exacerbation. And so the main difference here is that you do have an underlying history of anxiety and depression. And so you feel those symptoms all throughout the month, not just that 2 weeks of the luteal phase, but the week before your period and the week of your period, your symptoms are going to spike to an unusually severe amount. And that's going to be pretty consistent every menstrual cycle. So the key takeaway here to identifying if you might be struggling with this is really starting to use those apps to track your cycle, track your symptoms, and notice if you're seeing that ebb and flow around your menstrual cycle.
Okay. So now say we get a diagnosis. How what does someone do? What are some strategies you can recommend for someone experiencing these symptoms?
So you can actually make a pretty significant improvement to your quality of life and managing your symptoms by lifestyle changes. And so once you're kind of practiced in tracking your cycle, and hopefully you have a regular cycle, which will make it easier. Not all of us do, which could complicate the process. But if you
Mhm.
have a fairly regular cycle, you're going to want to start syncing to your cycle. Part of what makes this so difficult for women to succeed in life and in work when they have this is that we're in this patriarchal system and we are not little men. Even women who just have normal PMS are going through cycles, and we go through different phases and different productivity levels at different phases of our menstrual cycle. And so extra important for women who have a abnormal reaction to this to start allowing ourselves to be successful by syncing to what stage we're in. So if I'm in that superhero weeks, those weeks where I don't have symptoms and I feel like myself, that's when I'm going to do things like more high intensity exercises. I might have more social events in my calendar. I might have a more full work week that week. But then when I start to enter that luteal phase, I'm going to sync with that. And so maybe for exercise, I'm only going to do gentle, low impact activities like walking, yoga. I'm going to allow myself to have less going on in my social calendar. And if it's possible, this is where I'm going to want to put in accommodations at work. And a
Mhm.
key takeaway here is that in Canada, premenstrual dysphoric disorder is considered a medical disability, which does make you eligible for accommodations in the workplace so that you can manage your symptoms but still be successful at work.
Okay.
Um, Other things that you can do lifestyle wise is adding supplements. Research has shown that adding magnesium, vitamin B6, vitamin E, and calcium can really help to start to get some of these symptoms managed. I would also recommend a daily probiotic, especially if you're noticing those depression symptoms. You can look at using CBD oil, especially if anxiety and anger and irritability is one of the symptoms that is your main struggle. Kind of the starting treatment for women, you can be on oral contraceptive pills to help regulate that hormone fluctuation and to make your cycle more regular, allowing you to sync. However, it should be noted that some women can increase some women can experience an increase of your symptoms on birth control, and oral contraceptives won't be an option for you. And
Okay.
so if you do want to try the oral contraceptives, the only one FDA approved to treat PMDD is Yas.
Okay.
And so looking at treating the mental health symptoms, it's usually a combination of some type of SSRI that can help with anxiety and depression symptoms, such as fluoxetine, sertraline, citalopram, escitalopram. The trick here, though, is that we always need to have some amount of the dosage in our symptoms, in our system, so that it's in our system. But because our symptoms fluctuate, during our symptomatic period, we need to increase the dose, or else we're not going to see the same type of medication management as people with just anxiety and depression would. So again, we're needing to sync to our cycle to manage our symptoms. And then kind of the last ditch effort, if none of that is working, you're not getting any relief, is you can look at chemical menopause and surgical menopause.
Okay. So what are some lifestyle changes or things that people could start doing just on a daily basis?
On a daily basis, start to look at where you're at in your cycle and looking at how many units of energy you will have.
Okay.
And so if you are in your superhuman weeks, you are allowed to have more social activities. You're able to have that fuller shift like we talked about. You're able to do more high intensity things that take more energy because we have more energy. And then when we're in our symptoms, we really want to dial that back and give ourselves that compassion and that permission that it's okay to do less because you have less energy. And so we want to set ourselves up for success by allowing ourselves to accommodate ourselves in our symptomatic time period. It can also be very helpful to work with a doctor that believes you, that respects you, to help find the right medication and the right dose for you and manage the medication side of things. Start taking those supplements. A really great resource will be going to iapmd.org. It's an international association for premenstrual disorders, and there is free peer support groups. There is a resource of patient-recommended doctors who are treating premenstrual dysphoric disorder. And also connect with the counselor to help you work through some of that grief and help give you tools for your toolbox when your symptoms are more severe.
Okay, thank you. We do have a question here. It says, I talked with my doctor and they didn't really get into the issue and just offered sertraline. Do I take one in the morning and one in night or two at a time? I'm not too sure on that. Again, I would say consult a doctor, but we're not
It will
sure.
depend if you have premenstrual exacerbation for the person asking the question. So do you have symptoms all through the month? If so, you're likely going to need whatever dose has been recommended to manage your symptoms all of the time. And then the week before or the week of your menstrual cycle, double the dose. If you have premenstrual dysphoric disorder, you want to have some level of the medication in your bloodstream at all times because it can take 6 to 12 weeks for it to get into our system. But then during that luteal phase where your symptoms are the most severe, again, double the dose. And work with your doctor on finding that groove.
Yeah, I think there does have to be some medical intervention and maybe working with a specialist in the field. Would gynecology, for example,
maybe if they've
maybe
been exposed and know what it is. Again, really check out that iapmd.org if your doctor isn't familiar with treating it, because it does look a little bit different than anxiety or depression. And there will be doctor recommended psychologists and counselors and general physicians in your area. And if you're not able to find any, feel free to just put in the comments what area you're in, and I can help try to refer you to somebody who I know is familiar with it.
Okay, that would be super. Okay, so Cassie, this is an area you're quite passionate about. I know you're going to do some work with the Joshua team to really help us learn more. So that's
Mhm.
something that's very important to us here at Joshua Tree. So Cassie is working with all of us here and is also a mental health professional herself, has a master's degree in social work, and provides counseling in this area. So if you're looking for support, Cassie is a phenomenal resource. You can reach out to her, Cassie at joshuatreelearning.com, or you can book an appointment with her. And we invite you to take in some of the resources that Cassie has mentioned today. And yeah, we'll help you as much as we can. So thank you so much for tuning in today. Join us again next Tuesday at 12. We try to talk about a whole variety of different topics here at 12 o'clock. And sometimes we're running a little bit late, but we we try to get online before 12:15 for sure. And again, if you have other questions, please feel free to reach out to us. We're more than happy to talk and try to answer some of those questions. Thank you so much, Cassie,
You're
and
welcome.
take care.
For anyone out there dealing with it, it does get better as soon as you have the right tools in your toolbox. I promise you.
Okay. Thank you, Cassie. Take care and enjoy the rest of your day, everyone.